Thank you very much, Mr. Chairman. Honorable Ministers, distinguished. The meeting participants reviewed the current epidemiological situation and considered that the scale of the current Ebola epidemic is unprecedented, with reports of over 750 cases and approaching 500 deaths in Guinea-Conakry, Sierra Leone, and Liberia. They expressed concerns on the adverse social and economic impact. The participants noted and appreciated the current efforts by governments in West Africa, partners, and WHO to stop the epidemic. Nevertheless, they identified critical challenges to be addressed in the areas of coordination, communication, cross-border collaboration, logistics, financing, case management, infection control, surveillance, and contact tracing, community participation, and research. The Ministers of Health agreed that the current situation poses a serious threat to all countries in the region and beyond, and called for immediate action. The ministers adopted a common inter-country strategy calling for accelerated response to Ebola outbreak in West Africa. This strategy stresses the need for regional, sub-regional, and national leadership, coordinated actions by all stakeholders, enhanced cross-border collaboration, and participation of the communities. The meeting also reaffirmed the need of high-level national leadership by heads of states and governments in order to facilitate the intersectoral interventions and coordination required to cope with the epidemic. The role of the African Union and ECOWAS was considered essential to provide political and diplomatic support. Towards this end, it was strongly recommended that the forthcoming ECOWAS Heads of State Summit addresses the issue of Ebola virus disease outbreak during the meeting of the 10th to 11th July to be held in Accra, Ghana. After 2 days assessment and discussion on critical aspects related with the Ebola outbreak, the participants recommended, first, that the government mobilize relevant government sectors, community, religious, and political leaders to work together in improving awareness, psychosocial support, and understanding of the Ebola situation by communities in order to achieve a more effective response. Two, the governments to convene national intersectoral meetings involving key government ministries, national technical coordinating committee members, and stakeholders to map out a roadmap for immediate implementation of the strategy adopted at this meeting. That governments deploy additional national staff with relevant qualifications and other required resources to strengthen key activities in the hotspots of the transmission. That governments identify and commit additional domestic financial resources to support the outbreak response. That governments work and share experience with other countries that have previously managed Ebola outbreaks in the spirit of South-to-South collaboration. That the governments to organize cross-border consultation to facilitate exchange of information and agree on joint collaborative activities. That governments to strengthen surveillance, case finding, reporting, and contact tracing, and to share information on Ebola virus disease with WHO in a timely manner. That government to continue to strengthen international health regulation core capacities, especially those essential to respond to serious public health events. And that governments pay their contribution to the African Public Health Emergency Fund to support response to outbreaks and other public health emergencies. And that governments improve the information and communication to communities on matters related to Ebola epidemic, respecting the different cultural contexts, to enhance awareness and favorable behaviors needed to improve community participation in prevention, curative, and health promotion interventions. Partners were called upon to continue participating in the response activities in line with the identified country priority areas. That the partners should provide technical and financial support to response operations in Ebola virus disease-affected countries and preparedness activities in countries at risk of Ebola virus disease. And that partners ensure a coordinated approach in resource mobilization and allocation. And that the partners should continue to work with the World Health Organization in a coordinated manner to ensure a more effective response at all levels. The World Health Organization was called to provide leadership in coordinating the international partners at global, regional, and country levels in support of national plans. That the WHO should urgently establish a sub-regional control center located in Guinea-Conakry to act as a coordinating platform to consolidate and harmonize the technical support to West African countries by all major partners and assist in resource mobilization. The World Health Organization was also requested to mobilize and deploy the needed WHO staff and other experts, consultants, and institutions and networks, especially through the GON, to support the response to the ongoing Ebola virus disease outbreak. And that the World Health Organization should regularly disseminate updated information and risk assessment on the Ebola virus disease outbreak to all stakeholders. That they should develop and disseminate information, education, and communication materials for public and additional training materials for health professionals on matters of Ebola virus disease prevention and control. And that the WHO should facilitate cross-border inter-country collaboration, and that they should continue to provide the necessary support to strengthen core capacities most essential to responding to serious public health events, and that they should work closely with countries and lead an international effort to identify and prioritize key gaps and promote the required research to address Ebola virus disease and other hemorrhagic fevers. In concluding the meeting, the Ministers of Health expressed their satisfaction in the way the meeting proceeded and requested the Minister of Health of Ghana to thank His Excellency the President of Ghana, Dr. John Mahama, for facilitating the hosting of this important meeting. The ministers further requested the President of Ghana and who is the current chair of ECOWAS to highlight the seriousness of the current outbreak during the upcoming ECOWAS Heads of State meeting to be held in Accra, Ghana from 10th to 11th July. The ministers reiterated their call for action by all countries within and outside the region to provide support to the affected countries and communities in order to urgently stop the Ebola virus disease outbreak in West Africa. The 3rd July 2014, Accra, Ghana.
Thank you very much.